third party.
To the Premier, Speaker, you know, the reality is their budget went in the opposite direction of universal pharmacare. Speaker, there's nothing in this budget either for Northern Ontario, and no recognition of the unique challenges facing Northerners. Speaker, I already directed my question to the Premier. Perhaps you didn't hear me.
I trust the table as well. Please direct.
Everything is more expensive in the North, Speaker. People pay more for a litre of gas, for a carton of milk, for a dozen eggs. They pay more to heat their homes. And now, a senior living on less than $19,500 a month in Northern Ontario is going to have to stretch every dollar even further. Does this Premier think that it is fair to nearly double the cost of medication for seniors in Northern Ontario?
Question. Thank you.
Thank you very much, Mr. Speaker. Well, I have answered this question. I have said that the regulation on that particular aspect of our initiative is in the public realm for consultation, Mr. Speaker, and we have said that that we will look at that. But, Mr. Speaker, the leader of the third party has said she is proud to vote against the budget that that we just brought in, Mr. Speaker. Let me just look at what that means. Let's look at what that means. That means that this leader of the third party is proud to vote against transforming student assistance, Mr. Speaker, which will mean free tuition for low-income families, more affordable tuition for middle-class families, Mr. Speaker. She's proud to vote against taking action on climate change and investing cap-and-trade proceeds transparently into green projects that reduce pollution, Mr. Speaker. She's proud to vote against lowering hospital parking fees. She's proud to voting against improving services for children and youth with autism through a 5-year, $330 million investment, Mr. Speaker. She's proud to vote against all of those things.
Supplementary.
Up, down, up, down, up.
Be seated, please. Be seated, please. Supplementary.
I'm very proud to vote against a budget that grows inequality in this province, worsens our healthcare system, worsens our education system, doesn't create enough jobs for the people of this province, and turns its back on universal pharmacare, Speaker. And it's really clear that this Premier either doesn't understand the North or she doesn't care about the North, Speaker. The CEO of the Thunder Bay Hospital says that people in Thunder Bay will see health cuts because the province's funding formula doesn't make sense in the North. He said, quote, "We've seen a reduction in our budget of $500,000 last year on that formula. I think it overemphasizes population growth, so populations growing in Southern Ontario tend to get more of that money than we do. That's a problem," end quote. Why is the Premier ignoring the healthcare needs of the Northern families in this province, Speaker?
Minister of Health and Long-Term Care.
Minister of Health and Long-Term Care.
Once again, Mr. Speaker, there seems to be a theme here, and in fact, the theme might be a cardiac one, because just like I was talking about the new acute cardiac program that we're developing at Royal Victoria, we just announced recently in the past months a brand new cardiovascular surgery and vascular surgery program at Thunder Bay Regional Hospital. It's a single program, Mr. Speaker. It's actually in the partnership with Toronto General Hospital, and I was there. I can't remember the number of times I've been to Thunder Bay Regional Hospital for announcements there, to meet with staff, frontline healthcare workers. There's incredible activity taking place, the research that's going on there that we're supporting as well, and it's a not just a province-wide, it's a worldwide, world-class healthcare centre that we're developing in partnership with the leadership in Thunder Bay, including the health leadership that's there. I would hope that the third party would recognize that, what we're developing there, which is so badly needed, but so well-deserved, Mr. Speaker.
Thank you. Final supplementary.
Well, Speaker, how out of touch this health minister is. The theme is the cuts to Ontario hospitals, Speaker. That's what the theme is. And it's not just the Thunder Bay Hospital, Speaker. The Timmins Hospital has been forced to cut $35 million over the last 3.5 years. The North Bay Hospital CEO says that, quote, "This year has been challenging and the next one is going to be even more so," end quote. And we know that nearly doubling drug costs is going to hit Northern seniors as well, Speaker. When will this Premier start listening to the needs of the North and making sure that Northerners get fair access to the health care that they need, Speaker?
Thank you. The member from Eglinton Lawrence is warned. Minister.
Well, Mr. Speaker, I remain proud of the work that we're doing as a government in the North with our partners there throughout the healthcare system, the work that I referenced at Thunder Bay, the hospitals that we're renovating and building in the North as well, the fact that our 25 nurse practitioner-led clinics that exist around the province, many of those are in the North. In fact, the first was in Sudbury, Mr. Speaker. But if we want to talk about trends here, let's talk about the trend of them when they were in government, where they closed hundreds of mental health beds across 13% of the mental health beds across this province were closed, when they delisted home care from OHIP coverage, Mr. Speaker, when they fired 3,000 nurses when they were in power, Mr. Speaker, for that short period of time, the devastating impact that they had, that we've been rebuilding after the devastation of the PC party as well. I'm proud of our investments, including $345 million new dollars for hospitals across the province, a more than 2% increase this year.